out a dirty old window, down below the cars in the city go rushing by. I sit here alone and I wonder why. Friday night and everyone's moving. I can feel the heat, but it's soothing.
Hello, everyone. I hope you're enjoying the start to spring. Welcome to Growing Up in America here on 90.1 FM KPFT Pacifica Radio. I'm Dr. Chris Kulesza, also known here on 90.1 as Dr. Data, and I'm a scholar in child health policy at Rice University's Baker Institute. This is another special edition and Dr. Data Takeover episode. Today, I am thrilled to co-host with Dr. Katie Harris, the Alfred C. Giselle, the third fellow in drug policy at Rice University's Baker Institute for Public Policy this morning. Welcome.
Thank you, Chris. Good morning.
So this is your first time here, isn't it?
It sure is. Yeah, I'm happy to be here. Thank you for having me as a co-host.
Well, we're really excited that you can join us today. We also have Miss Data in the studio with us, Katarina Reyes, Research Manager at the Baker Institute for Data of the Day. Katarina, great to have you back.
Good morning, and good morning, Houston, and thank you so much for having me back. Really excited to be back on today.
Yes, so for those of you that are turning in for the first time, Growing Up in America is a discussion on our children, policy, and how do we as a city and community do when it comes to taking care of all our kids. This radio show is a production of Children at Risk, the voice of Texas's children, a nonprofit organization dedicated to research, policy, law, and collaborative action on behalf of Texas's youth. We're proud to present this program in partnership with ad-free community radio, KPFT. Each week, we aim to fill these 60 minutes with lively discussion on the children of Texas with experts on the quality of life for our children.
So with this being another special edition of Growing Up in America, we will be diving into the topic of substance use and policy surrounding children. We'll have our regular segments, Hip Speak, Data of the Day, and our teaser number today is 28.9%. So, Katie, do you have any guesses for what that might be?
28.9%. Is it the percent of Teslas that have been vandalized?
Oh my. Yeah, well, might be also the percent that the stock market has gone down in these past few days or whatnot. Yes, but we'll find out later on in the program as to what this is. So we are excited to welcome today's guest. Today we have with us in studio Harris County Sheriff Ed Gonzalez. We also have in studio with us Tracey Burnett-Greenup, the Chief Impact Officer at the Council on Recovery. And last but not least, we're going to be hearing from Drew Dutton, President and CEO of Phoenix House. So we'll take a short break and we'll be hearing from Sheriff Ed Gonzalez. Stay tuned.
Someone cry, someone, something to say, someone cry, y aprovechame.
All right, so today we are honored to have with us Harris County Sheriff Ed Gonzalez. Sheriff Gonzalez, welcome to Growing Up in America.
It's my pleasure to be here. Thank you.
So to start us off, please tell the community a bit about yourself and your role as sheriff.
Sure. Before I begin, I just want to really commend 90.1 KPFT, Children at Risk, and all of you involved in this program. One of the things that really inspired me to want to pursue elected office was I wanted to do my part to help dismantle the cradle-to-prison pipeline. And one of the key issues that impacts that is substance abuse amongst our adolescent population. So for me to be a part of this discussion, I commend you for bringing up these important policy discussions that's important for our community to have. But yeah, I'm proud to serve as a sheriff here in Harris County. It's the largest in the state of Texas and the largest, second largest in the country. And so we really see the intersection between so many different issues, not only crime and safety in our community, but addiction and mental health issues as well as the impacts on our children. Every year, for example, 90,000 children in our community have a parent that's incarcerated in our jail. That's always a very impactful data point for me, and something that I think I want to see what else we can continue to do to impact that number in a better way. But I'm so proud to represent the men and women of the Sheriff's Office that do the heavy lifting every day. Almost 5,000 employees that touch so many different key public safety disciplines and areas. And so I'm very proud to do the work. And I say that at this age in policing, we're in the front lines of three important issues, which are mental illness, addiction, and poverty. Frankly, I don't think policing should be in the front lines of those particular issues. I think we could have a key role. But unfortunately, for many failed public policies, we find ourselves in the front lines of those issues. And I think we could do better. And I would like to be a part of that change.
And thank you so much for your service. So, looking at the community, what trends are you really seeing? And are there any notable factors that you think are driving some of these recent trends when it comes to youth substance use?
Yes, there's a couple of things. One, of course, is we're seeing what appears to be greater substance use within our adolescent population. I think we need to continue to raise more awareness about that. For example, Harris County Public Health, the county department, recently did a study and really found some alarming rates. According to their study, they found that in 2018, there were 673 overdose deaths. That increased to 1,177 by the year 2022, which was a 74% increase. And yet we talk about it very little in our community. And so often a lot of our public safety policy discussions are centered around adults and not necessarily our youth. We're seeing a high prevalence of depression within our children. In fact, we just responded this weekend to a 10-year-old that attempted a suicide. And so we saw it in our own ranks, obviously with the adult population, but so often we forget about our youth. We have a youth council, and often one of the issues they bring is all the vaping and things that they're seeing in school bathrooms. And sometimes they bring it up to administration, and there seems to be a helplessness because they don't seem eager to solve the issue or maybe unable to do so. And so these are some of the stressors that we're seeing in our community when it comes to adolescence.
Yeah, and so you had touched a bit on the fact that law enforcement tends to be, on the front lines of responding to mental illness and substance use. And so could you just expand on that a little bit and kind of talk about some of the interactions that law enforcement has with the public and what the challenges are there?
Yes, obviously we respond many times, unfortunately, especially if there's a fatal situation that may result, from an overdose. But we're also when we arrest people, we end up finding out that there's all these criminal networks that are linked to human trafficking, the selling and providing of drugs. And so we see it in that end. We try to be preventive, but I think it's a matter, and I think that's why discussions such as these are so important. What is law enforcement role in that? I think I go back to the DARE model. Obviously, it was started by a police chief in collaboration with the school district back in the early 80s in LA under LAPD Chief Gates at the time. And I know research has basically shown that it was highly ineffective. And I know there's been other iterations. There's a different one now. But we have to find what's our role. I don't know if law enforcement can necessarily be the one driving that message of both don't do drugs, but at the same time, for me, I'm a big believer in harm reduction. But how do we do it effectively? And so these are all the things that we're grappling with. Obviously, we have an enforcement piece to it. But for me, much more importantly is intervention, prevention, raising awareness for parents and schools, and even our children as well. They're part of this discussion. And so often it's overlooked. We just would rather just lecture them.
So I'd like to talk to you a bit about those community partners and your work with schools and such. How does the sheriff's office collaborate with those partners, and what do those strategies really look like in those collaborations?
Yes, for us, we do have, for example, some of our deputies that have a lot of training. They go out and visit schools. We teach a lot about impaired driving because obviously that's a key issue as well. We see a lot of underage drinking happening in our community. We know we're coming up on prom season and some of these pop-up parties, and we see drug use there. And so we try to educate parents directly, one-on-one at different events. We work with different school districts. For example, we're involved with Crosby School District, ISD, for example, and we talk not just specific to drug use, but across the board, what are issues impacting the community out there. And then we also have a youth council as well with representation from different school districts to talk to them about what are issues surrounding drug use and other challenges that are impacting teens.
Yeah, and I think that's really important to highlight those partnerships because in a county like the size of Harris County, there's so much good work going on that can get kind of lost for some folks just because of the size of it. So I'm glad that you highlighted some of those. What I'm curious to know what policy changes that you think we could implement to make to have a better response to adolescent substance use.
Yeah, I think I'd like to see more uniformity, if you will, where all stakeholders are really engaged in really robust policy discussions. I don't see that there's always a strategy between, legislation that the state's trying to pass and local agencies as well. We all have a role, but I think there's not a central, if you will, process for us to all engage in talking about mental illness, talking about the things that we're seeing, the pill mills that are out there, and the the toxicity of some of what we're seeing out there when it comes to drugs, and really talking about these teens are still in a very developmental phase, and the potential impacts for future addiction and behavioral issues that stem from this. And I think also back to harm reduction, I think that a lot of our strategy historically, going back to DARE, has been the just no, say no
Hmm.
mantra and the abstinence model. But I think that we have to be more realistic and understand that if you look at statistics, and there's a high likelihood that by the time they graduate, most teens would have at least tried some type of narcotic. And we want to make sure that we're realistic and telling them, look, if you are going to use, how do we reduce the harm? Think of your public health, think of your health, think of other aspects. And at the same time, it's finding that right balance, because we don't want to necessarily say that it's there's no risk and that we encourage it,
Hmm.
but at the same time, it's finding again that right balance. And it takes really it's a whole community effort that's needed.
So, on that with parents, what would you say parents could best do to try to tackle substance use? And on that same flip note, what about the students and the youth themselves? What are their roles?
I think youth have a very important role. I know some agencies, such as, for example, the Houston Police Department, I mentioned us as well at the Sheriff's Office, we do have youth councils. I think for me, it's so important for us to engage with them and really have meaningful talk and get away from let's just lecture you until we're the adults in the room and we know better. We need to hear their concerns and what they're going through. And it's been very insightful for us to have those conversations with our teens and youth and really hear from them directly. And so I think there is a role to bring them into policy discussions and not just leave them out from the table. With parents, I think it's about continuing to raise awareness. I think it's just appalling to me to just see the variety of drugs that are out there. That something that looks as so innocent, like what would look like a pharmaceutical tablet, seems so innocent, and something that we all generally take for a headache or whatever could be laced with some fentanyl, and it can be extremely toxic. And so I think teaching parents more of that. And look, the reality of the moment is the world is turning upside down in many ways. You look at the economic markets and everything happening, people are afraid of job losses and things that could happen. There's a lot of stressors on adults as well. Again, we see the high numbers of suicides that are occurring. But we have to find a way to engage parents that have limited time. Maybe they're working dual jobs, just trying to make it, to still know what's going on with the children, to be nosy parents and to ask questions and be willing to engage with them in meaningful conversation.
Yeah, and certainly so many parents are under stress these days, as adults are generally. And you had mentioned earlier in this segment how so many children are impacted by having a parent that's incarcerated or caught up in the legal system. And so, what can we do to sort of help those parents that do have substance use disorders that get involved with the legal system? How can we support them in being parents once they get out?
I think it's so important for us to really do some asset mapping. I know Phoenix House and others are going to be here as well. And we have to continue to support those organizations that are doing good work and continue to build out capacity in our community. When I, for example, travel to the East Coast and look at some of the harm reduction models that they have in place, they seem to obviously have tackled this a lot sooner because they've been grappling it for a while, and they have community hubs where all the communities engage. they really have a strong continuum of care system. Here, it's not always necessarily the case. And so it's very challenging when we get called and a parent wants to say, hey, I think my son or daughter are experiencing with drugs. Where do you refer them to? It's very little help out there. And it's almost like they have to figure it out on their own. And there's just not a lot of capacity yet. When somebody gets hurt, physically hurt, we take them to the hospital. They're going to treat them immediately. But if you take somebody that's grappling with a mental health crisis or addiction, you're not going to find help that's readily available. Not because people don't want to help, is there limited capacity, and many times it's focused on adults.
Well, Sheriff, thank you so much for all of the work that you're doing for the community. It's been an honor to have you here. We really appreciate it. And you're always welcome back.
My pleasure. Thank you all.
Yes, thank you. And after the break, we'll chat with our next guest, Tracey Burnett-Greenup, the Chief Impact Officer at the Council on Recovery. So stick around.
Welcome back, everybody. And now we're with Tracey Burnett-Greenup, the Chief Impact Officer at the Council on Recovery. Thank you so much for being with us today.
You're welcome. Thank you so much for having me.
Yeah, and thank you for coming in studio. So can start off, please tell listeners about yourself and the Council on Recovery.
Certainly. My name is Tracey Burnett-Greenup. I am a licensed professional counselor in the state of Texas, and I am the Chief Impact Officer for the Council on Recovery. For those of you that are not familiar, the Council on Recovery has been around since 1946, providing services across the spectrum of substance use prevention and recovery.
Yeah, and so can you tell us a little bit about some of those services that you offer to parents and to youth?
Certainly. So we provide, as I mentioned, services across the spectrum from non-use prevention services to assessments, treatment, and all the way to aftercare. We believe that clients are going to come to us at different points in their journey, and we want to be able to support them anywhere that they come in.
So how does the council support other treatment and prevention providers? How do you work with those throughout the community to really make sure that families are getting what they need?
Yeah, we know that at the council, we know that nothing can be done in a silo. So a few examples of how we support and collaborate with others would be in our prevention space. We collaborate very closely with the schools. That includes teachers, counselors, and families to make sure that students are receiving all of the services that they need and that they're getting that connection. And then with treatment, we look at ourselves as the place to start. We understand that we are the place that you can come in and we will help you navigate your journey of recovery, even if that means ultimately that you end up not getting services with us. So we'll collaborate with other resources across the greater Houston area to make sure that your needs are met.
And can you speak about what we're seeing in Harris County currently regarding adolescent substance use?
Absolutely. So our counselors are seeing several trends across the greater Houston area. One thing that we've noticed is that youth are experimenting with substances around the age of 12 to 14. We know stats say average age is about 13, and that's what we're seeing in the schools. Some of the more common substances that students are reporting using are alcohol, vaping, and marijuana, along with prescription pills that were not prescribed for them. We've really seen an uptick in vaping due to the fact that it's deemed as maybe more discreet or less harmful, which we know is not true. Some of the other trends that we're seeing are the reasons for use. We're seeing more students reporting stress at home, peer pressure, just general curiosity and a desire to fit in. And then also hearing that they are accessing substances through older siblings or social media. But I don't want to be all doom and gloom. We're seeing some really positive trends too. We're seeing that the youth that we're working with in the schools, they are really aware of mental health and the importance of talking about it. They're more open about talking about feelings and coping mechanisms. They are engaging in positive activities when given the chance. So art, peer mentorship, leadership opportunities. And there's really a growing desire for that check in on your friends culture, right? Like checking in to make sure that your friends are okay.
Yeah, and that is something really important to emphasize, that it isn't all doom and gloom out
Right.
there, right? And there's a lot of good advocates, a lot of good organizations that are really trying to work on this, and that a lot of students are bringing it upon themselves,
Mhm.
right, to really take that responsibility
Right.
and try to reduce rates. So speaking about prevention itself, what characteristics are needed to make prevention programs effective?
Characteristics. So you can have a curriculum, but it's about what you do when you show up in front of the youth. How do you engage them? So prevention programs are really successful when they're interactive, when they give students a chance to be emotionally intelligent, to share how they're feeling, and to see how their thoughts, feelings, and actions are all linked. When they're youth-centered, they're very successful. So giving youth a voice in what the activities look like and how they participate. And I think this goes without saying, but when there's a safe, non-judgmental space, that doesn't mean that we're not going to share valuable education and tools, but it's a space where students can show up as who they are and share openly, because that's how we're going to continue that conversation.
Yeah, and I think that what you're saying is very consistent with what the sheriff pointed out about, sort of the limitations of programs like DARE and Just Say No, and how you do have to have that supportive environment that gives alternatives to substance use and not just saying that this thing is bad. So, and of course, prevention is always key. And when prevention doesn't always necessarily work for everyone, and then you have to get onto the treatment side, what are some of the characteristics of treatment programs that we know are most effective?
Right. So I think we heard Sheriff Gonzalez mention, we need to meet people where they are. Treatment programs are successful when we understand that every person is a unique individual or a unique family that's coming to us at a different place in their lives. So being very people-centered, allowing us to walk alongside them and meet their unique needs. So whether that be starting from an abstinence-based perspective or a harm reduction perspective. And treatment programs are really successful when they involve the entire family. That can be somebody's family of origin, their chosen family. We know that connection is incredibly important for recovery.
So can you tell us a little bit about the community and those connections within the community? What do they play in tackling substance use among youth? And how do we bring people together to really make sure we're having an impact on this?
Mm-hmm. Yeah, I mentioned earlier that it requires us to not work in silos. We are all whole humans who take part in a lot of different things throughout the day. And so it requires getting engaged with the schools, with workplaces, with community resources, every place that a person comes in contact with. We want to make sure that we're all working collaboratively and that we are looking at how we can work as a group to better serve the clients.
And the council does offer several community events. And so could you highlight for us some of those and the value that they play?
Sure, absolutely. How much time do we have? No. The Council on Recovery does offer a lot of events across the year. I'll highlight maybe two upcoming ones just because of the time proximity. So we have one on April 25th. That is our annual spring luncheon. This year we have Hank Hazaria joining us as the keynote speaker. And this is more than just a fundraising event. This is an opportunity to fill the room with people who need to hear about substance use recovery. We look at it as an opportunity to break down stigma and barriers and shame and allow people to hear that recovery is possible. And the council always has an uptick in calls in the weeks following the luncheon because, as we say, everyone knows somebody who needs us. And so sometimes it's people that have attended the luncheon, or it might be somebody that they know. Another event that we have coming up is on May 10th. It's the Wayfinders Workshop, and that is a half-day workshop for families with a loved one who has a substance use disorder. And it's an opportunity for them to learn about how they can support their loved one while also taking care of themselves. It's a wonderful event. But at the council, we provide our space for a variety of 12-step groups, recovery groups, trauma-focused yoga. We really look at ourselves as the hub for recovery because, as I mentioned earlier, the council believes that connection is the opposite of addiction.
So touching on policy, we're in the midst of the legislative session, right? There's a lot going on right now. What policy improvements are needed to better tackle substance use?
Yeah, we were talking a lot about prevention and community education. And so I think in terms of those, funding, right? Continued or more funding, allowing us to increase the education and awareness services that we're providing in the community, allowing individuals to be in more schools more consistently, allowing us to really just have those continued conversations and to be able to provide more resources to youth and families.
So do you have any other final thoughts that you'd like to share with our listeners?
Sure. Well, first of all, I just want to say thank you so much for having me on today. I've really appreciated this. I would just say that, if you're listening and you're walking away with anything, that recovery is possible, and that the council is here to help. We'll guide you to the right resources. You don't have to even know what you need. Just know that you want to call, and you can call 713-942-4100, or even hop online and engage in a chat, and you can take that first step towards recovery for yourself or a loved one.
Thank you for sharing that, Tracey, and for coming to the show today, and thank you for all the work that the council does. And after our short break, we'll be back with Data of the Day with Miss Data herself, Katarina Reyes.
And you are free to stick around if you'd like for Data of the Day and Hip Speak.
Okay, thank you.
Yeah, stick around. We'll be right back.
If you don't wanna see me dancing with somebody, if you wanna believe that anything could stop.
All right, so we're back with Miss Data, Katarina Reyes. Welcome back to the show.
Hi, Chris. Thanks for having me again.
All right, so the number for today is 28.9%. What did we guess earlier today? So I said something that had to deal with the stock market, with what we've been seeing since last week. What did you say?
I said something about vandalized Teslas. How many? Because that's happening a lot these days as well.
Vandalized Teslas and the stock market. Boy, do we have a lot. So are we right? How close were we, Katarina?
Ooh, sorry to tell you guys. This statistic is actually a little bit closer to home. So 28.9 is the percent of HISD students in 2023 that have ever used marijuana.
Wow, that's quite a bit. So can you tell us a little bit about what those trends have looked like a little bit over time? And also explain a little bit, what is the YRBS survey? Let's start off with that.
Sure. So the YRBS survey, or the Youth Risk Behavior Survey, is a nationally representative school-based survey of middle and high school students in both the public and private schools. This survey started in 1991 by the CDC and is conducted every other year. The data collection is anonymous and voluntary by the students, and it is completely self-administered. And the areas of focus include injury and violence, alcohol and drug use, tobacco use, nutrition, physical activity, and sexual risk behavior. So going back to the data, 28.9% might seem like a pretty high number, but from 2023, this has actually gone down, and it was 43.6%.
Yeah, and I would just say that, we're kind of fortunate in the sense that the YRBS, focuses on some specific schools. And so we're fortunate in Houston that we do have this very specific to us HISD data that we can look at. And I'm curious, so that's the percent of students who ever use. What is that? How does the percent for HISD compare to the national, what we're seeing nationally?
Yeah, so the national trends also show a positive picture regarding marijuana use. So in 2013, 39.9% of kids have ever tried marijuana, and it went down to 29.5%. So These numbers suggest that HISD is actually in a good position relative to the national sample in tackling marijuana use among their students.
So, can you give us a little bit about what's driving these trends? Like, what do you think is fundamentally going on with these numbers?
Yeah, well, there's a lot of factors that can explain this. I'm going to touch on a couple of them. So, legalization and increased availability. So, as more states legalize marijuana for recreational use, it's easier to access, um, leading to increased consumption, and also the rising prevalence of edibles and vapes and other products that could be, a little bit more attractive and easily concealable methods of consumption. There's also changing societal attitudes, so the public perception of marijuana is shifting, while more people are viewing it as less harmful than other substances like alcohol or tobacco. This contributes to its increased acceptance and use.
Yeah, and I think that that's an important point here because while it's very encouraging to see that the percentage of students who have ever used marijuana has declined, I think it's also important that we pay attention to the percent that, either report current use or heavier use. Because one of the things that we've seen, especially in states that have legalized, is that the overall percentage of people that are using hasn't necessarily increased, but we are seeing a rising incidence of cannabis use disorder. And that can be linked in part to increasing availability and also the increasing potency of certain products. And so we want to be very mindful of that from a public health perspective that, while legalization might be better than putting people in jail for using, that we also want to ensure that we're not encouraging use of a substance, the long-term effects of which we don't necessarily know, especially for adolescents.
Yeah, absolutely. And especially with the political climate that we have going on right now with the state legislature and we have quite a bit of legislation that's coming out of the state Senate, right?
There's quite a bit going on right now around hemp. And so if anyone is driving around town in Houston, I don't think it would be possible to miss the stores advertising Delta 8 and other hemp-derived products that have THC and are very similar to marijuana. And so there's a lot of efforts at the state level to regulate those products. There's some talk also of banning some of them. And, we just sort of have to see how that plays out this session.
So we are about at our midpoint, or we're just after midpoint. So I do want to ask some fun questions to the group. All right. So, Katarina, I have to ask, did you make a college basketball bracket and how did you do?
I should have. My brother was actually college played basketball in college, but this year, I don't know. I just didn't have the time, I guess.
I did not make one. I did watch. I was very happy on the night of the Final Four when Houston got into the championship and much less happy on Monday when they lost. And it was a heartbreak for the team.
How about you? Did you make a bracket?
I most certainly did. I love all things sports. And I'm proud to say that I got first in my women's bracket and second in my men's.
Wow.
Yeah.
Very nice. I did not make one. So I did my undergrad at Michigan State University. So I was really hoping Izzo was going to pull it off again. But of course, it just was not meant to be this year at all. So also, too, gardening. So how is gardening coming along? Does anybody garden when it comes to the beginning of spring or... Anybody know?
I wish. I hear it's such a great coping mechanism and so peaceful. It's just not the one for me.
That's how I feel too. And I wonder if I'll grow into it. I started taking, now I have my allergies under control. I have more opportunity to be outside. I'm sort of a succulent person. I'm on the little water, much sunlight, little care kind of thing is my...
No, my wife can say, so we inherited a garden when we bought the house, and that garden is no longer really there. There's a couple plants that survived. And I keep going to Home Depot or whatever, and I keep looking at things to buy, and I keep reporting back to my wife like, oh, I'm going to get this, and I'm going to get this. She's like, Chris, you're not going to take care of it. And I plant it, and you know what? She's right. Every single year, I don't take care of it, and that poor thing. But I've gotten like jalapenos in past years and things like that. We have a grapevine in the back, so every once in a while, I have a little bit of success, but not quite what I like. So, Katarina, thank you so much for sharing data of the day with us. We really appreciate it. So after this break, we are going to be back for Hip Speak. Stay tuned. Hello. So we are back with Rebecca George, Media Fellow at Children at Risk. Rebecca, thank you so much for being on. Oh, is Rebecca on by chance?
Oh, hello. Can you
Oh,
hear me?
hello. Can you hear us? Hello.
I can hear you just fine. Thanks for having me on. I always love being here.
No, thank you. So what do you have for us today?
Well, I have a bunch of words for you guys, and the first word I have for you to figure out is the phrase is period.
Really? Okay.
You said period?
Yeah.
You mean like at the end of the sentence where you say period?
Yeah, kind of like in that sense. Yes.
Yeah. So it's it emphasizes the point.
I would think that same thing emphasizes the point, or we're just done and finished and we're moving on. What do you think, Katarina?
Actually, I know exactly what it means, and that is exactly what it means.
Oh, nice. All right, so explain. What is it?
Well, that's exactly it. Usually it's used to like emphasize the point. But go ahead. I know I'm so sorry I interrupted you, but yeah.
Go ahead.
No,
okay. So
that's it.
All right. So what's our next word?
Period.
Yeah.
Period. Our next word, it's kind of a phrase and kind of like a phenomenon is girl math.
Mm.
Okay. What is it again?
Girl math?
Any ideas?
I don't know that I know how to explain it. Let's see. You go to Target, you get a couple things, and there's, I don't know, girl math, something to that effect.
Yeah.
Katarina's nodding.
It's like, let's say, it's a justification for like you buying something super expensive. So let's say I want to buy a $300 ball of perfume, and it's like, girl math says that's $1. Like if you divide that by 365 days, that's like under $1 a day. So it, like, I guess it makes sense. So girl math. Yeah.
You're on fire today. Like, you know all of these. This is fantastic. I mean, I'm still in the millennial generation, but I think that I'm still in touch with stuff, but my goodness gracious, this is showing my age. All right, what's up next?
Okay, your next word is to dip.
To dip. Okay. Do you have anything?
No, I feel like I'm wrong, and it just feels like a dance movement.
Yeah.
Really? All right.
I don't know. A dance movement. I'll go with that too.
Yeah, I mean, that reminds me of dance movements as well, or maybe it can mean like quality going down. I don't know. Like I'm Katarina, do you have some insight?
I mean, it may have changed over the years, but for me, it was like to leave. Like, let's get out of here. Let's get out of the
Right. Yeah.
All right. Are we right?
Yeah, to dip is to leave. Like to leave a room. Like I'm gonna dip. I'll see you guys later.
Oh, that's very good. That's very good. All right. Do you have any more for us?
Yeah, I have one more. This is my last one. And this is to ship.
Ooh.
Oh, okay. Tracey, you have something.
Yeah, so to ship, that's when you like want two people to be together. So you're like, I'm going to ship them. Yes. I feel good about that one.
All right.
Yeah, no, I'm going with Tracey again.
Yeah, I have nothing, so I'm going to go with that. Katarina?
I believe that is what it is. Yep, to ship.
All right. Are we right?
Yeah, that is correct. To ship, usually it's with two famous people because it gets kind of creepy in real life. But usually it's whenever you see two people and you're like, oh, they would be great together. And then there's like you can create a ship name where you combine their names. So usually to ship means to put two people together or like want two people to be together.
Oh, that's fantastic. So I'm going to ask you, did you make a college basketball bracket? And how did you do, if you did?
I did, and I don't think I did very well. I think I did put U of H being in the final thing, which is exciting, like the final game, which is very exciting.
Yeah, I of course just completely miserably got it wrong as always. But hey, I mean, with the number of different combinations you have, it's kind of expected, right? Usually millions of people submit brackets and they're all wrong, so I don't feel as bad, I guess. At least that's what I'm going to say to myself with that. So, well, thank you so much for joining us. We really appreciate it.
Well, thank you guys so much. I appreciate it as well.
So after the break, we are going to be hearing from Drew Dutton from Phoenix House, so please stick around. All right, welcome back. So we have with us today Drew Dutton, President and CEO of Phoenix House. Thank you so much for being on the program.
Thank you so much for having me. Glad to be here.
So please tell us a bit about yourself and the mission of Phoenix House.
Sure. So I'm a licensed professional counselor and chemical dependency counselor and advanced certified specialist. I've been working in substance use and mental health prevention and treatment industry for about the last decade and a half. And then I've been with Phoenix House about 11 years. It's an organization that's committed to providing treatment and prevention services to underserved communities with an emphasis on youth education and youth treatment. And currently, right now, we're doing all prevention services across the state, but we do have a long history of treatment as well.
Yeah, and hi, Drew. By the way, it's good to hear your voice again. I know that we connected in over the summer, and I got to learn a lot about the work that you do at Phoenix House. And could you just tell us a little bit about some of the nature of the prevention programs that you're offering?
Sure. The predominant focus on what we do is in-school programs. We do K through 12 education, and we have varying levels of curriculum and evidence-based practices we do, kind of based on the needs of the schools, the individuals, the communities that we're within, as far as maybe how direct or whether those substance use issues have already started to onset. And then we do some adult programs, and we do a statewide, national at this point, initiative called Project Empathy, where we're focused on training providers, teachers, counselors, legal professionals, how to better understand, identify addiction, substance use disorders, understanding it as a disease, and then things that they can implement in their setting to better respond to the issues they're overwhelmingly seeing.
So what are some of the primary challenges that you've had in supporting youth in our communities?
Yeah, I think, it's easy to say funding, right? But I think really the underlying issue is stigma. And I think that drives a lot of the funding deficits that we see is a lot of people truly carve out substance use separate from mental health and healthcare and continue to kind of have these ill-informed understandings of not recognizing it as a disease and just seeing these as, bad people or just, need to make better choices. And there's just a huge deficit, especially in Texas, as far as what's available for effective treatment or being able to sustain and fund some of these programs that are trying to do great work, especially for youth across the state.
Yeah, and so speaking of Texas and treatment in this state, can you tell us how Texas compares to other states in addressing adolescent substance use?
Yeah, unfortunately, not well. We present a lot, especially tie in Mental Health of America's annual studies, and a lot of the metrics, Texas comes in dead last as far as our ability to provide access to care, and youth completion rates and engagement rates are very low. And we certainly know that this is a state that's heavily affected by substance use disorders, by overdose deaths, by everything that comes with not having these initiatives in place. We seem to have a really hard time sustaining programs and making sure that they're available to youth, especially those without the financial means to access treatment elsewhere.
Yeah, and you mentioned that Phoenix House used to provide treatment services, and now that it only works on the prevention side, could you speak a little to how that why that's the case?
Yeah, we had treatment programs in about 5 different locations across the state, and we had the last residential program for youth that were unfunded or underfunded in all of Dallas County that closed in 2023, and then in Travis County and Austin, right there by the capital as well. And then we had programs in Houston, Round Rock, San Antonio, and then in virtual to reach our more rural communities. And when we had to close, we were essentially kind of one of the last few people that was able to do this, just because the reimbursement rates we get just do not adequately, cover the cost of what's needed to provide these treatment. Even though we know the return on investment is really strong when we treat youth, as far as the cost saved by, not letting those conditions worsen, develop, and everything they result in.
So, of course, we're in the midst of a state legislative session, and there's a lot going on when it comes to substance use. So what would you like to see from the state legislature for improving adolescent drug policy? Like, what, if you could wave a magic wand and have a bill go through or multiple bills, what would those look like?
Yeah, I think that, one is, freeing up the SAMHSA dollars that do come to Texas, finding a way to adequately spend them, because when we closed our doors and other providers did as well, it wasn't due to being no funding. It was just not being able to access it adequately. There was funding left in our contracts, and many of the other providers that closed had funding as well. So finding a reimbursement rate that really works for providers and treating those federal funds as the baseline. Texas really should be willing, and the community should be willing to invest in these programs on top of that and really see the need to help these kids and to help their communities in the ways they can. And then I think the second part would really be like, we really need to take a fine look at the Texas Administrative Code and where can we get rid of some of these really antiquated and outdated and ill-informed kind of practices that really don't speak to what we know about the nature of, co-occurring conditions and best practices and person-centered approaches for addiction that we know now, and update a lot of that language.
Yeah, so speaking of the co-occurring mental illness and substance use, because that I think is certainly a big issue, and maybe you could speak a little to the trends that you're seeing in the prevention programs, and maybe some of those disconnects between what you're seeing and how the state seems to treat those issues.
Yeah, overwhelmingly, it's trending to where we're seeing, significant, rates of suicidality and anxiety and depression, especially with teens now. And I think there was this thought that substance use can be treated just in complete isolation as kind of a standalone issue. And what we know is it's really, really high co-occurring and comorbidity rates with mental health. And effective prevention and treatment really needs to take both into consideration and be able to address both. Understand how, using to cope with your depression, anxiety can be a driving force. So we've really got to be able to address individuals much more holistically than maybe we had kind of mapped out previously of, treating substance use as more of a criminal issue, and then making mental health a separate focus.
So Phoenix House offers volunteer opportunities for the public. How can the community get involved?
Yeah, our phoenixhousetx.org is our website, and contact at phoenixhousetx.org is a great email to get involved. But what individuals can do is reach out, especially in the Dallas, Austin, and Houston communities. We've got opportunities to engage with our staff and their communities, whether that's through helping with events or services we provide. And we also have a lot of people that, support at a distance, whether that's through assisting with donations or donations of supplies, to keep these efforts moving along, productively. I think there's a variety of ways that people can connect, and we like to play to what their interests and strengths are. So we certainly encourage people to reach out and figure out how they can help their community as well alongside us.
So do you have any final thoughts that you might like to share with our listeners?
I think reach out. We've got some really good initiatives. We would love to bring our workshop project Empathy out to those that are interested. We've got educational, and we can do them low or no cost. If financial means are a barrier, we can make sure we get those resources for free. And we're more than willing to train teachers, staff, whatever the environment is, on all the up-to-date substance use trends, understanding addiction, understanding the best approaches. We want to really help provide a safe space to answer those questions that staff, families may have. And we're certainly happy to create the space and venue for people to get the information I think a lot of them desperately want to understand better.
Excellent. So before we close out, there's some fun questions I do want to ask you to end. So did you make a college basketball bracket, and how did you do?
I did, and I had Houston all the way, and it was an absolute heartbreaker.
I am so sorry about that. Yeah, and it really looked like it was finally going to happen this year, right? So also, do you do any spring cleaning at all? Have you started? Is that something that you do? So I know, like in our house, we keep getting people coming by for doing pressure washing, right? We're in the midst of pressure washing season. And also a lot of people asking to do roof repairs, right? It's like once spring comes around and the weather starts getting better, all of the vendors start coming out. Anybody else get that happening, or?
We've got all kinds. We actually just finished up a recent add-on. We built on a new room for our 3-year-old son at our house. So we're in the process of getting moved back into our home. We've been displaced for a while and getting everything tidied and finding new spots. So lots of cleaning and organizing going on over here. That's for sure.
Oh yeah, that is a big project. I just had a friend that did that as well, and they were out of their house for I think a few months. There are some foundational issues that kept them backlogged. So that's great that you're getting back in there.
All right. Well, thank you so much for joining us, and you're always welcome back. Thank you for all the work that you do.
Yeah, thank you, Drew.
Thank you. Yeah, thank you all. Greatly appreciate the time.
All right. So, Katie, what did you think today? What are some of the key takeaways that you might have had?
Yeah, so I think that our guests all sort of touched on a few things that are important to highlight. One being the need for sort of coordinated care, especially in large communities like Harris County, where there's a lot of different efforts going on, but people aren't always aware of what is happening. There's not always communication across the county about those efforts. And then Drew, I think one of the points that he made that's really important is the need to treat these illnesses of mental health and substance use as co-occurring. I know one piece of feedback that I've heard from a lot of providers of substance use services is that, on the mental health side, there are a lot of folks who don't necessarily treat substance use, right? And then there's substance use providers who don't necessarily treat the mental health issues. And so operating in those silos is kind of a challenge when for these individuals, these issues do co-occur.
It is, and particularly the mental health issue. We know that most counties, the vast majority of counties in Texas are mental health deserts, right? We just do not have the kind of support out there. In schools, for example, our counselors, we do not have the proper counselor to student ratio. And indeed, the money that was provided during COVID-19, that is all dried up. And many of the counselors don't speak the language necessarily. So we also have a shortage of those that are either Spanish speaking or able to really interact with those communities.
Yeah, all of those are issues. And, again, like it's, sometimes it feels repetitive to harp on funding, but these are things that require money and long-term investments, and also require, having strategies that reflect the reality, right? So, for example, with certain providers, issues around reimbursement rates, right? And what kinds of services they can get reimbursed for. It seems sort of like a detail, but it's really critical to ensuring that these services are supported by professionals.
So I do want to ask you this question now that we have, again, bringing up the legislator, now that we have the state legislative session, what would you like to see come out of it?
Yeah, well, I think as far as treatment goes, I think that one very important issue, and again, this is something that Drew touched on, is increasing the reimbursement rates. Because currently, the state-funded treatment slots, especially for residential, they do not reimburse providers at a sustainable rate, right? So increasing that reimbursement rate to ensure that the empty beds can be filled. I mean, we have providers that say, we have slots for state-funded clients, right, who don't have insurance, but we can't fill them because we can't afford to do it at these rates. So seeing an increase in those reimbursement rates with money that the state has, the legislature has funds to do this, and it also gets those federal grants from SAMHSA, that is something that I would really like to see them do on the treatment side.
Right. And of course, it's so difficult now because we're in the midst of major cost cutting, right, at the federal level and at the state level, this idea of DOGE. So how do we navigate that government efficiency is indeed important, right? Making sure that we have, money, taxpayer dollars going to things that we all can really get an impact from. That's important. However, we also have to consider on the flip side, what communities are being impacted, what people are being impacted, and is it being done in a really purposeful way, or is it more just chopping away and not knowing what we're really getting at?
Yeah. And I mean, certainly there are a lot of different goals here that are in tension with themselves, right? So on the one hand, yes, folks want government efficiency. On the other hand, for example, the Office of National Drug Control Policy, which comes from the White House, has put out, goals that they want for drug policy. That includes funding things like treatment. And so, you have that tension there, and the states historically have relied on a lot of federal funds to support treatment services in the state. And so I think that there's going to need to be a reconsideration of that approach. The state also has a whole lot of money in opioid settlement dollars that it can be using. So that's another feature of this.
Excellent. Katarina, any takeaways?
What really resonated with me today, which was echoed by everybody today was that, in order to tackle mental illness or even substance abuse, is that it's a three-pronged approach. There's intervention, prevention, and then, of course, continuity of care. So just having all three of those things to create the perfect circle to get people what they need.
Oh, that's excellent. Thank you so much. So that is all the time that we have for today. Thank you for joining us. This is Growing Up in America by Children at Risk. If you enjoyed our discussion, please tune in next Wednesday from 9 to 10 a.m. Have a wonderful week.
I hopped up the plane at LAX with a dream, my cardigan. Welcome to the land of fame excess. Am I gonna fit in? Jumped in the cab, here I am for the first time. Look to my right and I see the Hollywood